Thank you so much for everything.
So I'm Anagha, I'm from Pune as he mentioned. To answer a few of your questions, I have completed a home country residency. I finished a neurosurgical residency from Pune and I'm an old graduate. So after finishing my residency, after a couple of years of practice, I've applied to neurology. And let's get started with the PPD. So a bit about my credentials. I'm an old graduate, like I said. I graduated in 2011. I had 240s on both the STEP exams with a home country residency. I completed 3 months of US clinical experience with 5 publications, and I luckily matched in my first cycle. The challenges that were ahead of me was being an old graduate and having changing a specialty. So success in residency match depends on so many factors. You know, everyone has been talking about these factors since we have been here. Scores, research, USCE. I think there is no shortcut to matching. There is no shortcut to hard work. Okay, this is a very long journey, and we all have to work hard at each step of it. Step scores are important because, that, like Dr. Swayman said, if you have low scores but you do spectacularly well in your rotations, those scores will always try to pull you back somewhere. So try to work hard on each and every step. Be very determined and don't give up at any step. Be ready to work hard for like 1 or 2 years till all of this finally comes into a match result for you. So plan ahead in time, plan your step exams. USCs usually start getting filled up. The university observerships or electives are filled up almost 6 months to 1 year in advance. So you have to look them up way ahead of time and plan your travel, plan your vacation days and everything so that you don't miss out on those opportunities. You have to also do well on the USC and get good letters of recommendations. The way LORs work are, if you are at a university setting, a university letter will always hold more value than a community or a clinic hospital. So always try for university electives or observerships. And secondly, the content of the letter also matters. So how you do well in your rotations matters. Try to be proactive, try to interact with the residents, try to suggest that, I will come up with a topic for presentation. What can I present on? Just a 10-minute talk before rounds or after rounds. And these things get added in your letters of recommendation. Be on time, don't leave ahead of time, be polite and courteous to everyone. Next is program outreach, and I think what helped me I got 16 interviews, so I think that was a really good number and I was lucky. And I think what helped me was early program outreach. Reach out to the programs early, before September, not after September, but reach out to them in June, July. Start emailing them, saying you're interested, express your interest. Write program specific emails, okay? So you have time, spend time and find out a particular quality about the program that you really like and mention that quality in the email. So it's a personalized email to the program expressing your interest, and it's not like you're just saying, sending a mass email to say 100 programs, which any program can understand that, this has just been copy pasted. So it should not be that way. Avoid grammatical errors and avoid any mistakes. Don't write some other PD's name in some other program's email. That happens when we are emailing a lot of programs. So be ready with all of these things before you actually apply. So for USCE, I get many questions. How do we look for USCE? University observerships are very hard to come by these days. Since COVID, international medical graduates have been struggling really badly for university observerships. Clinic rotations are still available, so keep that as a last resort. What you can do right now is when you're looking for observerships, these are some of the keywords that you should put into Google. Okay, we are not familiar with these terms. How they see us are visiting international students, visiting international physicians, or an international observer. Follow these words or phrases with the name of the university or the specialty that you're looking for, and you will come up with many Google results. I think there are many universities that have now opened up. Cleveland Clinic is one, Case Western is one, Yale does have research fellowships, Mayo, all these big places will have research as well as some clinical rotations. Also try to reach out to all the Indian doctors that you know. It's like if you're interested in medicine, there are associations in India of doctors who are practicing medicine. Someone somewhere knows someone. So it is very important to start networking right from India. It doesn't necessarily have to start when you go there. So reach out to all of your contact, all of your family members, someone somewhere knows someone that can help you. Just get, you just need a 2 or 3 weeks of shadowing experience. And it is also very important to clarify what you expect out of the rotation before you start or when you start. So say you start the rotation and within a week, you should tell your attending that I am applying for this specialty. If it's a different specialty than what you're rotating in, it is important to convey that you are expecting a letter of recommendation. You should also ask them what you can do after a week's of rotation. You can ask them for feedback as to how I did, what I can do better. I am expecting a letter of rotation, a letter of recommendation from you. And also some universities will require you to have an ECFMG certificate. So I think Sunny Upstate requires an ECFMG certification, and they do allow students to observe with the certificate. So for Neurology Match, to be very specific, we do have a neurology panel in the afternoon also. So I don't want to spend too much time focusing on neurology specifically. But for neurology, the specialty specific profile is really what they're looking for. They don't want to see that you're applying to neurology as a backup specialty. Because many students do that. They will apply combined IM, FM, neurology, because these are specialties where IMGs do get in easily. But that should not be the case. Neurology is a very specialty focused branch, and they look for dedication and devotion to neurology specifically. Usually scores above 220, 230s are acceptable for neurology, unlike surgical specialties where you need really high scores. And again, a few publications, neurology specific publications, it can be as simple as a case report. In your medical school, in your internship, you can start writing small case reports and send it to our local journals. It doesn't always have to be published in worldwide journals. You can start with the Indian journals as well, which are our national journals. And 3 to 5 publications, I think, is a good number to have. Also for USCE, if you're applying for neurology, it is okay to have 2 neurology and 2 internal medicine rotations. I think that is acceptable. As long as you show some inclination towards the specialty, that is going to be good. So briefly, my timeline, I gave step 1 in Jan 2022. I completed OET in May 2022. I went for my rotations in July, and I also planned my step 2 around the same time. So I gave step 2 in July. I had my rotations from June to September. I completed my applications when I was there. After just about finishing my rotations, I waited, submitted my applications, completed my rotations, and then came back. Your last rotation should probably end in August or mid-August. It takes time for your letter writers to compile your letters, upload them on the ECFMG ERAS portal. So give about 3 to 4 weeks of time for that. Don't finish the last rotation in September. Your last letter may not come on time. Next was the interview season, and finally in March, I was happy to know that I matched. So again, challenges for IMGs. We need higher step scores than the American graduates and our American counterparts. So that is a fact. So work hard on your step 2 and step 3 now. Also try to take step 3 before you're applying. It's always better if you can finish all the 3 exams, but I would not recommend risking step 3. I had paid for my step 3 exam. I wanted to take it in September before I came back, but I was not prepared. I didn't do well on my assessments. So I contemplated. I spent a lot of money on cancelling a paid exam, which really hurt me. But I think a bad score or a failure would have done really bad to my application. Rather than, hurrying up and just taking step 3 for the sake of it, I decided to not go ahead with step 3. And I think neurology is a bit lenient about step 3, unlike some other specialties. So it was okay that I did not have step 3 at that time. It would have been great if I could, but I didn't. Then the next is we don't have connections with US physicians, but we already spoke about this. So do your first rotation, start building connections. Start asking the first physicians, where else can I rotate? Do you have any colleagues or any other suggestions where I can get more opportunities? So that's how you start your connections. Then is we have to overcome program filters, unfortunately. That is a fact. Some filters are set for visa requiring applicants. Some are for the year of graduation, some are for the scores, and some programs may have some other filters depending on their specific requirements, like maybe work experiences or research experiences. So try to fill in all of these categories in your CV, work on your CV 2 to 3 years before you're going to actually apply. We all have less research experience because we are always working. So like I said, a case report is not really difficult. You can always start with a case report, go to PubMed, see how case reports are written. It's basically just a case, an abstract, a few brief discussion about the case, and that's it. And you need a few references, so you can definitely start writing case reports. Also, we are new to the process of interviewing and writing personal statements. So I think these are the points or the aspects of our profile where we do need some help. So make sure to write your personal statement, start working on it from June, and also practice interviews with your friends and colleagues. So yeah, we touched upon these points. Program outreach, start reaching out to the programs sooner than September. So I was a Sarthi student, and I would say that because I was an old graduate, I didn't have my colleagues who were applying with me. If I did have them, we could have practiced interviews, we could have helped each other with program lists. So for me, Sarthi was helpful for their interview preparation. I think the interview sessions were one-on-one interactions with the chief mentor Pawan and also some other panelists who will tackle behavioral questions or medical questions. I think that aspect really helped me, and their timely guidance on how to reach out to programs. I think had it not been for their guidance, I would not have known to reach out to programs in June or July. So I think that did wonders, and I got so many interviews definitely because of my outreach. And also they helped us, they have a lecture, they have many lectures on these, how to write your CV, how to reach out to programs. So I think because of that, framing the outreach letter was really helpful, and I definitely do give credit to Sarthi for that. So these are just some of my paintings on each of these slides that you were seeing. Also have a hobby. I put these to say that also have a hobby. These were great icebreakers, and I was in some interviews we just were talking about hobbies or things that interest you. So definitely have a hobby that you can talk about. Start volunteering somewhere. Don't just do it towards the end of the application, because then it is very obvious that you're just doing it to fill in that volunteer experience. You don't want that. So make sure you have a full profile and a good application when you're applying. And I think that's it. I will conclude my talk. If you have any questions, I'm happy to take them.
Hi Dr. Anagha, thank you so much for your presentation. I just wanted to ask you, how did you convince the programs that you had an interest in neurology but your base was in neurosurgery? So were such questions asked, and if yes, how did you tackle them?
Yeah, definitely. I mean, that was where all my interviews were centered around as to why I'm changing or what has drawn me to neurology. And I was honest about it. I have worked closely with neurology, neurosurgery, neurology, always work hand in hand. And I wanted more bedside time with the patients, time in clinic, which surgery did not allow me. So I was very honest about these points, and I told them about my journey, and I applied as soon as I could after the pandemic ended. So that's how I tackled that question.
Anybody else has questions?
I have a question that for those who have a home country residency, will the Indian LORs be of use, or they have to do USCE compulsorily?
It's always better to have US letters because we are coming from outside. They need someone to speak on your behalf who is from their country, and they need to know that you know their system. So only someone who is practicing in the US can say that about you. Okay, this person has worked with me. Etiquette अच्छे हैं, they know how to behave in the clinic or patient care, and they are aware and they are good clinically. If it comes from a US physician, it has more standing. You can have one Indian letter, but it's preferable to have all four. Otherwise, one Indian letter and 3 US letters should be okay.
Thank you.
So you you said that the applications for US clinical experience are 6 months before, yeah. So then, but then if one has not cleared steps, so I think the chances of you getting the chance for doing the US clinical experience would be lesser, right?
So not all USCE require all-step exams. Some universities are specific about it and they have listed their eligibility criteria on their websites very clearly. Like Sunny Upstate will mention you need to be IMG certified. University of Missouri, Columbia will mention that you need to be certified to be an observer or to even start an application. So we don't know where to find these things in the websites. It's usually under the education part. In education you have residencies, you have fellowships, and then when you go to residency or you'll see a visiting student section or an observer, or you can always email and reach out to them, reach out to the GME office or reach out to the residency coordinator to just ask them if they have observations. It's always best to reach out and get a no than never to reach out. So you'll have to send out a lot of emails to even get a few replies.
Thank you.
There was one question in the back.
Ma'am, you had started planning about the residency, the US residency prior to 2 to 3 years prior to the application, or approximately a year was sufficient for you to, according to your timeline, you had started?
Yes, I did start planning before applying, definitely, because I had to plan to subscribe to the Q bank. So I subscribed to the question bank about a year and a half before I actually took the exam. And I think until I subscribed to the question bank, I didn't start preparing seriously. So also don't waste your time, say, yeah, I'll read books or something. No, just start with the questions. That is the best way you're going to retain. And once you have a Q bank subscription, there is a subconscious deadline that gets set. Ye mera 6 months ka subscription hai, I have to finish this in this time. And once you don't waste your money also, obviously. You have to know that it has to be a realistic approach. But what I'm saying is don't spend 6 months reading books, then starting the question bank. That is the biggest mistake. Start with the question banks and the main preparatory material right from the start. So I prepared from a year before I actually gave my step.
Hello?
So hi Dr. Anagha. So I had a question about the program outreach that you mentioned. Do you think you could give us a tangible example or two on how you actually did that? Because I'm not sure how I connect with the program. That I have no connection with, that I have no personal contact with, on how I'm actually interested.
Yeah, I can speak to you about this in person also after I finish my talk. But briefly, what I would say is it has to be, the email format can be standardized. It can be, dear the program director, I am so and so. These are my credentials, briefly in bullet points. If you have your step scores, if you are a medical student, you finish your residency, 3 US clinical experiences, 5 research hubs. Okay, and then you mention why you are interested in their program. That is the next paragraph. And you conclude in one line saying, I would really appreciate, I look forward to hearing from you. And you also have to attach a small CV. So prepare a good professional non-ERA CV, which goes out with these emails everywhere.
Good morning, ma'am. Ma'am, I just have a question regarding research, especially neurology specific, in the States as compared to in India. Like, does doing research in the States hold more importance than doing in India?
Definitely. If you get the opportunity to work with someone remotely also from India, that will definitely look good on your CV. But do whatever you can in your capacity as of now. Don't overstretch yourself and stress yourself too much that if I don't have US experience, I'm nowhere to be seen. I didn't have any US experience. I did have a lot of home country experience, yes, but I didn't have papers in any US journals. I also had simple case reports. I just had case reports, a few articles in some other Indian journals, and that should be enough also. They have to see that you are inclined to work. Then if you're given the opportunity to uplift that experience and you have peers with whom you can work more and put in more efforts, that you can take your work to that level if given the opportunity and training. That is what they need to see, some readiness in you. That's the whole point.
Anyone else has questions?
So I know there are some rules regarding post-interview communication. Is there something like that for pre-interview communication?
No, absolutely not. There are no rules. You can always express your interest. If you have some questions, something is vague on their website, you don't sponsor a visa. You can always ask them, do you accept J1, ECFMG sponsored J1 visas? Or these are my credentials, how can I work on my profile to do better? There is no rule on pre-interview communication. Some programs, if they say, don't email us after the interview, then you should not email them. But most programs will not say that, and they are easily approachable. This was my experience in neurology. IM can be a little different because of the number of applicants, simply because of the number of applicants. Some programs can specify that please don't reach out, but it's still okay to send a thank you email after your interviews or after they respond to you. And definitely you can email them for research opportunities or any of these things.
Okay, so
Also, most universities, if you find a physician sponsor, they are ready to have you as an observer. This may not be on their website, but if you know someone who knows someone, like I said, and if they are ready to let you shadow, barring a few paperwork and whatever the formalities they need to complete, they will accept you to shadow them.
thank you.
And also the US physicians know how to write a good letter of recommendation. Unfortunately, that is actually true. And some rotations may ask you to write your own letter. Initially, we may think that's a good thing, but I think we don't know how to write these letters yet. And it can be very evident when a program director is reading it. They can tell who has actually written this letter. So make sure everything on your application is honest and up to the mark. Like what an American graduate would do, try to have the same content on your application.
Hi, Dr. Anagha. I just wanted to ask you how many neurology programs did you apply to? And also, when you applied for neurology, did you apply for preliminary track as well as categorical track or only categorical neurology?
Yeah, so that's a very complicated thought process, and how much your budget is actually, very frankly, because by the time you've traveled, you've spent on USCE. That was my situation. So I applied broadly. I applied to all categorical programs to begin with. I first left out the Ivy Leagues to see how much it was costing, and then some programs which are advanced but take IMGs. Unke specific, they have some specific prelim programs which is given in their website. Or you also see that once you log into your ERAS and you're searching for programs, you see that this prelim is attached to this advanced program. So then you only apply to those specific prelim programs. But I think applying broadly is very important as an IMG. Also, Residency Explorer will sort these programs for you based on IMG percentage. So start applying from that order. Look at also the states which are IMG friendly first, cover all those places, and then go on to the lesser IMG friendly states.
Yeah, just one more question. So when you talk about reaching out, do we just reach out to the program director or do we reach out to all the doctors from the faculty or just the Indian doctors?
So it is okay to send out small emails to all the doctors if some particular area of their work interests you. They are working on some particular research or involved in a clinical trial. All these can be found on their websites. You can reach out to them specifically as well. So in the university website, if it's mentioned that once you find a sponsor, we are ready to take you, in that case you definitely can reach out to all of the doctors there.
My question was pertaining to reaching out just before the interviews to express interest in the program.
Oh no, so in that case you should just email the program director and the coordinator. Okay, and maybe the APD at the most, but you don't need to express interest with all the faculty, that's not necessary. I guess that's all. Someone, yeah, you can please stand up and ask.
So recently, first of all, good morning, Dr. Anagha ma'am. So recently I read online there's a Buffalo, New York rule where you're only allowed to do only 12 weeks of USCE if you're an international medical graduate. If outside of your home school you do more than 12 weeks, it's not acceptable in New York. So you won't be able to interview.
I think those New York rules are more applicable for Caribbean graduates. I am not an expert in those rules, definitely.
Okay.
But
I just wanted to know the validity of.
So basically that's a 12-week NYC rule.
Yeah.
You cannot take 12 weeks out of your medical student life and rotate in any part of the country for more than 12 weeks.
So you won't be able to do your New York electives if it were to exceed 12 weeks.
Yeah, so if your number of New York electives exceed more than 12 weeks, you become ineligible to apply to certain New York universities. Okay, but that does not mean that you cannot get clinical experience in New York or anywhere else after more than 12 weeks. You can always do externships and observerships after you graduate,
Yeah.
right? So in your medical school life, it should not exceed 12 weeks if you're applying to NYC colleges. But after you graduate and you want to add more weeks of clinical rotation, you can't do that. That does not come under the NYC criteria.
Alright, thank you so much for having me. I thank HOU for giving me this opportunity to reach out to everyone, and I hope you all match, and you will, definitely.